Peds Patrol here, and let's talk about measles again. So I posted this video almost a year ago when there was a measles death in Ontario. In February, and still happening right now, there are measles outbreaks in Texas, and there was a death of a child recently as well due to the measles infection. This is very tragic and sad news because there's been tons of advocacy around getting the measles vaccine and reducing the risk of getting measles while you're traveling or even while you're in your own country. There's a lot of things that you'll hear on social media with regard to having agendas. And doctors do have agendas. Pediatricians have agendas. And what is really the agenda here? The agenda is to keep kids alive. We want kids to be healthy, active, and happy and contributing members of society when they get older so they can be the leaders of tomorrow. That really is the agenda for all pediatricians. And it's amazing to think that we have different ways of prevention. We have primary prevention, which is vaccines. And then we also have things like tertiary prevention, which is treating diseases. So we have medications for diabetes like Ozempic. We have medications for asthma like Flovent. But we really don't have a lot of medications for viral illnesses like measles, which is why primary preventions or vaccines are so important. Because at the end of the day, if a child gets measles and they get really sick and they have brain infections or complicated pneumonias or even death, we really can't treat those. And I know it's really hard for parents and other caregivers to make decisions about primary prevention because you're theoretically treating something that your child will never have. But that's something that you have to think about because it's all about risk. And if you live in places where the risk is higher because of decisions that family members make or the lack of education or the lack of prevention or access to care, then sometimes it may behoove somebody to actually take that plunge and get the vaccine. Here's hoping that whether you're in Texas, Florida, that you go talk to your primary care provider, your family doctor, or your pediatrician, get that information, talk about risk, and then make a meaningful decision whether or not you want to get vaccinated or not. Because at the end of the day, no child's life is worth it when you actually have treatment that can be safe and effective and prevent it from the first place.